talking a little bit about the Bowtie Brunch. It was started by Kendrick Clack, our former chair of the Men's Health Committee, as an opportunity to not only highlight the work of the organization's male members, but to focus on topics that were impacting Black men's health. The first event was hosted in 2019 at the National Conference in New Orleans and focused on topics of mental health and the impact of adverse childhood experiences. The event was well received, and personally, I was really inspired by the entire program. To be there at my first conference and to focus on topics that, impact those near and dear to me was just so important. I'd like to now take the time to introduce my co-chair, Mr. Josie. He is the co-chair for the National Men's Health Committee and historian for the Greater New York Black Nurses Association. Go ahead, Josie.
Good morning. Thank you, Aaron. Appreciate that. My name is Josie Perpignan. I'm the co-chair of the Men's Health Committee for the MBNA. Also co-founder of Greater New York City Black Nurses Association and the current historian and chair of the membership committee. Looking forward to an amazing event. I'm going to be introducing our moderator in a second. But as Aaron said, Mr. Clack is the one who really started this event, and the virtual aspect of the event started during the pandemic. So Kendrick utilized that opportunity to shed light on the disparities and all that our communities, Black and Brown, were going through, especially during the pandemic. So we shed a lot of light on educating, uplifting, providing resources, and just making sure that we were a voice for our communities that didn't have one. So I'm going to introduce Dr. Sheldon Fields, who is the founding president of Greater New York City Black Nurses Association, current first vice president of the National Black Nurses Association, current associate dean of diversity, equity, and inclusion at Penn State University School of Nursing, and our future MBNA president, my mentor, Dr. Sheldon Fields.
Good morning, everybody, and thank you so much, Josie. Thank you, Aaron. Welcome, everyone, to this really exciting and very important conversation we're going to have today about organ and tissue donation. I am Dr. Sheldon Fields. I have the extreme high honor and privilege to currently serve as the first vice president of the National Black Nurses Association. NBNA, 50 years strong, is the voice of the Black nurse in America. In our over 100 chapters in 35 states and the District of Columbia, NBNA's core mission is the uplift and to bring voice to those communities in which we live, work, die, and play. And we take that mission seriously, and not only uplifting the voices of Black nurses, but in those Brown and Black communities that need us. So without further ado, we're going to go ahead with our program this morning because we have a lot of great information. And I really want to begin by thanking LiveOnNY New York and the Sierra Donor Services for their participation and support of this event. Without them, it just simply could not have been possible. So without any further ado, I really want to introduce Dr. Bo Kelly, who's going to be our first speaker. Dr. Kelly is a pediatric adult liver and multi-organ transplant surgeon. He is surgical director for the Sierra Donor Services and currently sits on the board of directors for the American Society for Transplantation. He is an alum of Howard University's College of Medicine and recently moderated a very important discussion with Dr. Ibram Kendi. He is a surgeon, leader, and ultimately defines success as delivering expert value to patients. Good morning, Dr. Kelly.
Good morning, Dr. Fields. Thank you so much for the invitation. It's a great honor to be here. My sincere apologies for not having a bow tie. I feel highly underdressed.
It is quite all right, sir. We are very glad for your presence. And we would really like to begin our discussion with you this morning in talking about how the healthcare system is changing to level the playing field of the organ transplant, especially in terms of the historic wait list.
Yeah. Well, the short answer there, Dr. Fields, is I don't feel that the healthcare system is changing enough. I don't think that the healthcare system is at present leveling that playing field. And so I think there's a tremendous amount of work that needs to be done. Now, I can't undermine the work that has been done. Historically, our communities have not been engaged with the healthcare system in the ways that they should be. There's obviously a lot of racialized care in our country. But I can say in the transplant community at present, there is a certain concern about the racialization of certain opportunities for Blacks in healthcare. What I mean by that is there are certain standards that have been long time established that have disadvantaged Blacks in participating in not only access to transplant healthcare, and specifically, I can say that roughly a third of the transplant wait list at present for the kidney transplant wait list is composed of Blacks and Latinos. But unfortunately, that's the group of individuals that we know that got from a dialysis center to a transplant center that were then wait listed for transplantation. And I can tell you, if I were to give you the pictorial of a pipeline, you would see that there's a whole lot of leaks in that pipeline. There's a tremendous amount of patients out there that we have no access to. I can't even tell you what number of Black patients out there have end-stage renal disease or chronic kidney disease who are not seen by dialysis centers and who are not referred for transplantation. And so when you think about what our healthcare system can offer, our healthcare system has to do a better job of identifying patients who are at risk, getting those patients to dialysis centers, getting those dialysis centers to be incentivized to actually refer those patients to transplant centers. And then once they get to a transplant center, they have to be evaluated in an equitable way. They have to have equal opportunities for transplantation. They have to have equal opportunities to participate in living donation. And we have to get them off the wait list if we have any aspirations of achieving the same types of outcomes that are currently observed in other populations.
Thank you for that. Can you talk to us a little bit more about how do you think that we can truly be intentional about the ways in which we attempt to close the gaps and the disparities that we see in donation and transplantation?
Yeah, I love this question, and I love it because I posed it actually to Dr. Kendi in my conversation with him, and not in a way that I wanted him to solve my problems in organ donation and transplantation, but really to get his perspective on, again, the racialization of certain areas of healthcare. And the discussion and my sort of view on that is that at present, similar to what I described in the kidney example, is that patients, or I should say Blacks in our communities, are disengaged from their own healthcare. They're not empowered. There's a lack of sort of autonomy and decision-making. And so if the healthcare system is to do anything, I think it starts there. I think we need to really examine ourselves, examine our policies, and examine our beliefs about Blacks in the healthcare system. And unfortunately, there's still too many longstanding prejudices, is really the only word I can use, that are ingrained in medical students, trainees, and it just sort of rises straight up the ladder. So if we really want to impact those populations, I think it starts there. The second piece I think that would be actionable would be policy formation. I think looking critically, if we just started at the transplant center and even at the organ procurement organization level, if we look at every single line of what we do, and we think about the opportunity to either disadvantage a population or raise up a population, I think we can probably re-engineer how we think about organ donation and transplant and figure out better ways to engage our community. There are programs all over the country. I have a colleague who works out of Chicago, actually, Dr. Danae Simpson. I'll mention her name because she's a fabulous transplant surgeon who's developed an African-American transplant referral system where she actually has a program within her transplant center to help identify and navigate African-Americans through their transplant process. And so there are just these little examples of ways in which we need to engage our community at a higher level, engage our communities where they are, churches, schools. These educational processes can start very early, and we just need to re-engineer a new culture of thought process around autonomy of our own care. I don't think that most of us think about the fact that end-of-life care can include discussions about organ donation. And I don't think that those conversations are typically offered to us because healthcare systems just don't think that our communities would be interested in engaging in those conversations. So I think that it starts with the autonomy and the ability for our communities to feel comfortable raising those conversations with our healthcare providers and making them aware that this is part of what we are interested in as a community.
Mm-hmm. Thank you for that, Dr. Kelly. Can you say a little more to help those who are listening really understand the disproportionate need that exists in communities of color, as you talk about ways in which they could actually help and actually get involved?
Let me ask you, so when you say disparities of healthcare offerings, or?
No, I'm talking about the higher need for organ transplantation in certain with certain organs, especially due to chronic disease in communities of color.
Yeah, I mean, sort of like I said, I think that the unfortunate piece to this is that we don't even understand how many of our communities are at risk or in need of this type of very specific care. And part of that stems from the fact that our communities has just been so disengaged from the healthcare system at all, so distrustful, and rightfully so, of the healthcare system. When you talk about very specific chronic care, so patients who have diabetes, patients who have hypertension, patients who have cancer, all of these categories, our Black community has been underserved. And there's this bias that somehow that's just how we roll, that's just part of our DNA. And we're really not on par, and certainly not considered in balance with the types of therapies that are out there. And so I just use transplantation as a very high-end example of a very specific care that is disproportionately not offered to our communities. And it starts there. Identification of patients, re-education of the referral patterns, and serious consideration and education of our communities so that we know how to advocate for ourselves.
Mm-hmm. And how do people get registered to actually be an organ donor and to really, again, intentionally include these types of plans in their end-of-life planning? Yeah,
that's a magic question, and I'll say that it varies from state to state. And most of my comments are really thinking about healthcare that's offered to our Black communities for the management of very serious and chronic diseases like kidney disease. Mm-hmm. When you start talking about organ donation, that's on the other end of the spectrum, but really part of the same conversation when you're talking about advocating for yourself. And so again, I think it begins with that personal empowerment to know that, you know, I'm making the decisions with my healthcare provider. It's not just them making decisions for me or deciding what opportunities are available to me. I'm actually participating as an active partner with them to decide what levels of care I can receive. Transplantation and organ donation are not offered everywhere. So it's very easy for the healthcare system to simply ignore our needs when it comes to the sort of the places where we are and the places where those programs are, and not providing the logistics and the resources for, you know, a poor somebody who's in a rural part of our country to get to the types of healthcare that we're describing. You know, just don't exist right now. And that's where I think a lot of the action items can occur. Specifically to your question about organ donation, you know, I think once an empowered individual understands that part of the trust that we have in our healthcare system involves the ability to give back to our community and to give back in this very significant way by organ donation, then I think that the education and the conversations can become somewhat more bi-directional and easier for patients to engage with their healthcare providers. So signing up for, you know, organ donation is one aspect of it. Serious conversations with your family about your end of life wishes becomes a second and critical component of that. You know, the living wills and all of the legal sort of options that are out there, I think are things that we could certainly engage in, but most of our communities really want to do this in a more, you know, kind of person to person way.
Well, Dr. Kelly, I know that you are at another meeting and you took time to be with us this morning, and we are incredibly thankful for that. But I want to ask one last thing before we let you go today. Talk to us as Black nurses. What do you think we can do?
You know, Black nurses are critical to the care of our patients. If I were to make a recommendation to every healthcare system, it would be to make sure that we have adequate representation of the populations that are being served in those areas, and that Black nurses, as the really touch points for all levels of intensive care, and I'm using intensive in the matter of that one-to-one type of care that needs to be administered in our communities. They serve as the frontline conversation for really all things healthcare. Black men in particular, I think, serve as role models in our healthcare system. I think that level of communication needs to happen throughout our healthcare system, but I think happens probably most impactfully from the nurse.
Again,
hopefully that answers. Were there any other questions? I'm sorry I talk so much, but I'm passionate about these things, and I want to make sure that I get this message across.
Nope, your passion comes across clearly, and we understand that, which is why we're all here today. But I do want to thank you for your time and stepping out of your other meeting and making time for this important conversation. We thank you very much, and we hope to see you again on a future presentation.
Absolutely. Please feel free to reach out with any questions. Thank you all. I appreciate the work that you all do. Thank you so much.
All righty. So we heard from Dr. Kelly, and what we're going to now do is we have put together a really exciting panel of experts, current and past recipients of organ transplantation. So I'm going to invite those individuals one by one as I invite them to unmute themselves and introduce themselves to you in their own way. I first want to start with Mr. Torin Leday. Torin, you can go ahead and unmute yourself.
Right. Oh, there we go. I was able to unmute. Hello, everyone. Good to be here today. So I am a supervisor of what are called family care coordinators at Sierra Donor Services. My role and the people under me, we are the people who meet with the families first. We're the ones who either request donation from families or inform families of their loved one's decision to be an organ donor. So we are the first face of Sierra Donor Services when it comes to the families. We also are typically the one of the first people that the medical teams meet before we even talk to the families. So that is my primary role.
All right. Thank you, sir. We're going to come back to you with some questions, but we want to go ahead and introduce the rest of the panel. I'm next going to go to Mr. Kervins Lusant.
Good morning, everyone. Just want to take a quick second to say thank you to Aaron, Josie, Dr. Shields, and also Dr. Fields, excuse me, and also LiveOnNY for giving me the opportunity to be present and join this meeting for this amazing discussion. I'm the Vice President, Chief Clinical Officer for LiveOnNY. Been with the organization for over almost 15 years, nurse by trade, and I oversee the clinical coordinators that manage the organ donation process within our hospitals, and I look forward to further expanding on that conversation today.
And thank you for joining us today, sir. Your work is really important, and I have some specific questions to you in just a moment. I want to now let Mr. Keith Ivey introduce himself.
Good morning. My name is Keith Ivey, and I am a heart transplant recipient. And actually, yesterday was my 13th anniversary of my heart transplant. So it's pretty amazing.
Wow. Thank you so much. Thank you so much for being here today, Mr. Ivey. I'm pretty sure the audience is really looking forward to hearing about your journey and your experience. But let's introduce Mr. Eric Platt.
Is the camera? Can anyone hear me?
Absolutely.
Okay. Hi, my name is Eric Clack. I am a recipient of a bone marrow and a liver transplant going on 23 years now. And I'd like to thank everyone for giving me this opportunity to speak and let you guys know how, it happened. And
how old are you now, Mr. Clack?
I am 36 years old.
Wow, so you were 13.
Yes.
Wow. Well, let's introduce our last panelist, and that's be Mr. Philip Jones.
Good morning, everyone. Can you hear me? Okay.
Yes.
Okay, fantastic. My name is Philip Jones, and my life as I'm the Senior Vice President of an organization called America Works of New York. But even better than that, I am the grandfather of a donor's hero, my grandson, Jaleel Michael Williams. And I'm happy to be here representing the grandfather side of a wonderful young man, my grandson.
Yeah. The family part of this, Mr. Jones, and the fact that a lot of times these processes take place as a family. So can you actually tell us about your grandson?
Oh, I'd be more than happy to. Jaleel was born August 4th in 2000, and we were fortunate to know him for 43 days. He transitioned on September 16th, and on his 36th day of life, my daughter at the time was 18, let the father watch him, and my wife and I were sleeping in the bed, and next thing you know it, we hear the phone ring, and we hear that Jaleel is not breathing. So jumped up, got in the car, and we're in Brooklyn, ran through so many lights, and got to the brownstone where he was. And I don't know if you all remember the Oklahoma bombing here in New York. one of the pictures that was famous was a fireman carrying out a child out of the wreckage. And then this limp baby was in his child's arm. That's how I saw my grandson Jaleel come down the stairs with the ambulance driver running to the ambulance. And we ran straight through, followed behind the ambulance, went to the hospital. And my daughter was just a nervous wreck, of course, and I was also. But, you know, being the grandfather, being the daddy, you got to put on those big boys hat and clothes and support the loved one. And the nurse came back out and said, hey, we gave him an extra dose of the adrenaline that he shot in the back of his head, was able to resuscitate him. And where we were in the pediatric ward, and I have so much respect and admiration for the nurses because what they did for our family was just the most amazing support that we could ever imagine in life, where they were able to put in nothing but God. There was a room with a big picturesque window that was overlooking Jaleel in the emergency area there, and they let us stay there the entire week. And we just stayed there 24/7. And Jaleel had two uncles at the time, also 1 and 5 years old at the time. And just going back and forth, my daughter stayed there religiously, of course, with her son. And thank God for LiveOnNY New York. And I'm gonna have to tell my story. If I don't tell my story, my daughter would get me. And not knowing that my daughter had already had a conversation with a representative from LiveOnNY New York the day before, we're in a hallway. I'm walking my daughter around just so she gets some air. This person from LiveOnNY New York comes up and said, hello, Katrina. And then I wanted to speak to you about being a donor. And my first impression, because I was in my feelings, I said, hell. And my daughter automatically said, of course we will. And I had to step back. My 18-year-old daughter is the adult right now in this situation. Now, mind you, I am a donor. I've checked donor on my license that I want to be a donor. I'm a licensed minister. We talk about, you know, life and saving lives, doing whatever. But in that moment, I was a human being there supporting my daughter, and this person came in that environment and interrupted my time with my daughter and said, asked this question, I was trying to protect her, I thought. Mm-hmm. And thank God she had the wherewithal to say yes. Mm-hmm. And so that is my story about my grandson. I'm sorry, I could go on and on and on.
No, it's absolutely fine, sir. Do you know how many recipients were able to benefit from the gift that your family gave?
Most definitely. That Saturday morning, we said our goodbyes. And that was about 8 o'clock in the morning. 11:30 that night, we received a phone call, and we found out that Jaleel saved the life of 2 babies. One received a heart, the other a liver. And through LiveOnNY New York, as my daughter just got back involved with him a year and a half ago, we found out that the young lady that received the liver has just given birth to a child. So his legacy lives on here. So we're excited about that.
Again, thank you so much for sharing your family's lived experience. I want to go back to Mr. Leday. So Torrin, you just heard, and you heard what Mr. Jones had to say. You work for Sierra Donor Services. So tell us a little bit more about exactly what you do and how do you approach Black families to even consider organ and tissue donation?
Well, to piggyback a little bit about what Dr. Kelly was saying earlier, people of color make up the majority of the waiting list when it comes to kidneys, right? Our people have a long-standing history of lifestyle and heredity that makes us vulnerable to a lot of kidney failure. So, and thank you, Mr. Jones, for sharing. By the way, Mr. Jones and people like his family are, especially from my perspective, are the single most important aspect of organ donation. In my opinion, if we do right by our donor families, everything will take care of itself. Specifically, when I approach African American families, I remind them or inform them of the disparity in healthcare, that people of color do make up the majority of the waiting list, yet we are not likely to donate, right? So I like to point out some facts about organ donation, and also that we need to help our own people. And when I say that, the likelihood of someone getting someone else's gift from that same demographic is high because of the matching process, right? So when you donate your organ, there's a very good chance that you will be saving one of your own, right? Don't get me wrong, a gift is a gift. If you save a life, you save a life. But just through the matching process, through the genetics, there's a very high likelihood that someone will of your demographic will receive that gift. Also, I like to talk to people, families of color and our families in general, that there is what's called directed donation. So if you are the family of someone who is giving, or whether they're registered or you authorize donation, you can ask that an organ be directed to someone that you know who is in need, family member, friend, whoever it may be. You have that right, and that person automatically moves to the top of the list. So that's my primary conversation I think I like to have with families in general, but definitely with families of color. You know, and a lot of it is answering questions, dispelling a lot of the myths and what have you about donation, about the misconceptions. So a lot of talking, a lot of listening takes place, and for me it's about giving people, families in general, the information that they need to ultimately make the best decision for them. And also to go back to what was said earlier, even better than the registration is having that conversation with your family, right? About what you believe, about what you would like to do given an end-of-life situation.
So there's a question that popped into the chat. So I'm going to address this to both Mr. Ledet and to Mr. Lassant. And it's about age limits. Are there age limits for the donor for either kidneys or heart?
Okay, so I guess I'll start with that question. In terms of the heart, yes, there is an age limit. Typically, it's up to, I would say, up about 65 and under. 65 and under, with good cardiac function, of course. And what was the other organ? Was it kidneys?
Yes.
Okay, in terms of kidneys, typically kidneys under the age of 70 are higher likelihood of being transplanted. Patients above the age of 70, there's still intent to transplant for those. You know, it depends on the function, the history of the patient. You know, we will biopsy those kidneys and kind of really do further assessment in terms of looking to try to find recipients. So typically 70 and under for kidneys, 65 and under for heart. That's typically the standard.
Okay. So while I have you both here, so Ms. Lassant, you work for LiveOnNY New York, again, based on the East Coast here. So talk to us a little bit about what you're seeing in terms of the number of organ referrals that your agency receives, the volume that you all work with, And specifically, how do you do outreach to people of color communities?
Okay, so maybe I'll kind of loop it all in together, right? So in 2022, we had approximately 478 organ donors and 1,300 organs transplanted, right? So kind of looking at it, we cover about 13 million population, which is approximately 100 hospitals. And the hospitals are responsible to make referrals to us, right? In terms of our total number of organ referrals, we had 7,478 organ referrals in 2022. Of that, 1,946 of them were African-American patients. So about 26% of those were African-American. Our authorization rate for the African Americans for LiveOnNy New York was overall 38.9%. How many African Americans are waiting for a life-saving organ in New York? 2,697 out of 8,119, or 33%, right? Are African American, right? So, and if you break that down even further, right? How many African Americans are waiting for kidneys and needs of dialysis? Right. So 2,000. So right. So that initial number, 2,697, are waiting for a life-saving organ. 2,509 are Black waiting for kidneys. Right. So that goes back to that point of how many of us need a kidney. Right. How many organs went to African Americans in New York? Right. So 778 out of the 2,836, or 27% of those organs went to African Americans. So just to kind of give you some context from that perspective. What we kind of see in the field, and the biggest thing I try to make my team focus on, is really focusing on communication, right? The experience that family member has, that donor family has at that hospital is extremely important. And it starts from the second that they step in the door, right? So to Mr. Jones' point, when he went to, I think it was Kings County, right? When he was in that hospital and they provided a room and they allowed the family members to stay 24/7, that communication, that support, right? That's extremely important. I don't know, and I'm sad to kind of say that that's not always consistent, and once you start having communication gaps where family members are not being kept up to breast in terms of where their loved one is, in terms of the diagnosis of whether it's brain death or their critical condition, what's the patient's plan of care, things of that nature, that starts causing mistrust. And that leads us down to a situation where the family may not want to donate. So we really work heavily behind the scenes with our hospital partners to really try to make sure, like, the medical team focuses on updating the families in real time, letting them know step by step what's going on with their loved one, because that's really important, and that helps to really kind of allow the donation opportunity to even take place successfully.
Well, again, addressing this question to both of you because of the experience you have working with your organizations. And there's a question that popped into the chat again from one of our listeners today that's about consent. So if someone has consented for organ transplantation, upon their death, can the family actually rescind that consent?
The short answer is no, they cannot. When you become a registered donor, that document of gift, as it's called, is a legal and binding document. It carries the same weight as an advance directive or a will. So the short answer is no.
So from a legal standpoint, it becomes codified, as you're saying, in the way in which it's legally forcible. So the family at that moment, you know, cannot take away consent.
Correct. They cannot.
Okay.
The only way that that consent can be overridden is if there is a more recent document that carries the same weight that has been enacted. If you have an advance directive that is at a later date that states the intentions or the desire of someone.
Okay, okay. Well, thank you both for that overview, particularly with the organizations that you two represent. I'm going to come back to you, but I really want to bring into the conversation today our two organ recipients. So these next set of questions are going to go to Mr. Ivy and Mr. Clack. So if they can join us on screen. So Mr. Ivy, when exactly did you receive your heart transplantation, and what is the difference you feel it has made in your life?
I received my transplant on February 24th, 2010 at Stanford University. And in terms of the difference in my life, obviously I'm alive. It has allowed me to continue to experience life and to witness the marriage of one of my sons, and 2 grandchildren have been born since then, and just continue life and being with my family, and continue to do stuff I love in life. That makes life worth living.
Over this all these years, have you ever had any contact with your donor's family?
Yes.
What was that like?
Well, I'll give you the short story. I got transplanted on February 24th of that year. And excuse me, probably by about May, I was pretty much back to normal, back to normal life. I happened to be in the halls of Kaiser in Santa Clara, California. They do all the pre-work and post-work. Stanford actually did the transplant itself, but Kaiser did the pre-work and the post-work. So I was walking, I had an appointment, I was walking down the hall, and a social worker asked me, she said, "Hey, Keith, how you doing?" I said, "I'm great." I said, "I'm back to playing golf and doing the things I love in life, and it's fantastic." She said, "Are you going to write a letter?" And I said, "Write a letter for what?" She said, "Well, if you'd like, you can write a letter and give it to me, and I will forward it to UNOS, which is United Network of Organ Sharing. They'll do the research and try to find out where the organ came from and get it to the letter to the family." I said, "Oh, okay. It sounds like something I'm going to consider." And I got home, I discussed it with my wife and my children, and I told them that I thought I was going to write this letter. So I put a lot of thought in the letter, because how do you thank somebody for giving you the gift of life and saving your life? So anyway, I wrote the letter. I gave it to her in May, and I never heard from anybody. But I did hear from somebody, but it was around Christmas time of that year. So you're talking 6-7 months later. I had totally forgot about it. I happened to be in the grocery store that day, and I was checking out, and I heard my cell phone ring, and I let it go to voicemail. I was by myself, so after I checked out, I got in the car. I said, "Let me see who called, see if it's important." And the voice on the other end of the voicemail said, "Hello, my name is Patricia. I got your letter today. You have my husband's heart. Call me." And so I said, "Whoa, this is real adult stuff here." I forgot about it. And so I said, let me call this lady right now and, thank her. And so I gave her a call, and we must have talked for 30 minutes, sharing the story of what happened to me. And she shared the story of him, my donor, her husband, and what happened to him and his family background. And yeah, so we never really met, but we talked the next year. They were considering having a celebration of his life, and they wanted me to be there. And I wasn't sure I wanted to do it. And before I called her back to say, I don't know if I'm not comfortable with it. Before I called her to let her know that, she called me, and I guess the family had discussed it and didn't think it was such a good idea. So since then we've lost contact, but yeah, that's the story.
Okay. Thank you for sharing your experience. I have another question for you in a moment, but Mr. Clack, 23 years. That's amazing. So tell us the circumstances of what led to your need for a transplant and how you've been doing since then.
Yeah, sure. Well, I believe I was in the 8th grade. 8th grade, yes. Still in junior high school. It's close to the end of the year, and just one day, all of a sudden, I woke up and I had jaundice, real bad. My eyes were yellow. And, me being a kid, I'm thinking it's cool. I'm like, this is the coolest thing. I got yellow eyes, Somebody else have yellow eyes out here. And, little did I know it was going to lead to this situation of me having a liver failure and bone marrow transplant and everything. So I went to the hospital, and what ended up being 2.5 years there in Texas Children's Hospital, which they did take good care of me. And it just led from one thing to another, like you're wondering when you're going to go home. And, every day something new comes up, whether it's sugar, diabetes, or, fluid, anything. Like I've had a number of complications while I was in there. I've had shingles, of course, catheters, and just you name it. Like I've had it, and all within 2.5 years. And another thing that really gets to you, because it really taught me how to deal with things. And I would have friends, that come in that would be admitted to the hospital that would, all of a sudden they telling me they went home, they went home, which, me as a kid, I'm wondering like how I came in here first, how they get to go home before me, but little did I know they didn't make it. So it taught me how to just really deal with things, from issue after issue coming up. And but as far as the bone marrow, which came first in 2000, it came from a woman in Rhode Island. I did get to connect with her. She sent me gifts and we talked on the phone. I did lose that contact, but I did try to reach out. I know her name, and I haven't been able to find her since.
So you had the bone marrow transplant first. So
Yes.
when did you receive your liver transplant?
In 2001, a year later.
Okay. And what about that recipient?
He
Or
died in a
donor?
car accident. So, his
Okay.
family, we never did get in touch with them. It was just I got put on the list, and
Mhm.
I was fortunate enough to get a liver when I needed one,
Mhm.
and that was really.
So as a long-term multi-organ and tissue recipient, how are you doing now? And what did you go on to do with your life? What are you currently doing?
Great question. I've been trying to figure that out for the longest, like everyone's telling me, you survive, you're here for a reason. And, I go year after year wondering, what it is, but I always seen how I was good at helping people and getting a better understanding of things. Because even inside of the hospital, when I had, like the diabetes and things like that, where I have a dietary, a dietitian, that's what I look for. A dietitian to come in and they tell you can't have this, you can't have that. And so I started wondering why. I started asking myself why, and figured out that I could have it only in moderations.
Mhm.
So I started doing that, tweaking that, I'm counting every little calorie, sugar, and everything I eat. And now I get to enjoy everything that I want, pizza and everything else instead of the chicken broth that they get you now. So anything that I start doing, I don't stop until I get to the bottom of it. And I've recently, a year ago, just started day trading. And here a year later, 13 months later, I have more knowledge than people that did it for decades.
Mhm.
And I'm actually getting ready to launch my YouTube channel here next month. I've been building the studio for the last couple months. That's why my camera's all kind of crazy and stuff right now. I'm still getting it up. And I'm just going to help people with that aspect of, it's going to be not for amateurs, but for people that seriously have careers in the market that I know more than they do.
Yeah. So I hear you're going to have some stock tips for us, some financial literacy.
Very much, very much.
Well, I'm here for that YouTube channel. Make sure you send that to us.
Sure, no problem at all.
Thank you for sharing your experience. I want to ask you both. You have here people who are really interested in not only the topic, but we're Black nurses. We're men who happen to be Black, who happen to be nurses. Talk to us about what would you say or help us to say to people who are considering donating?
I say definitely do it because you are giving people a second chance, and it is wonderful, and that's probably one of the best things that you could do after you die, because I mean, you're no longer doing it, and someone else can, and they can go on to do great things.
Mhm.
And I would say that donation can really continue your legacy through someone else. My donor was killed on a motorcycle, but in a way, he lives through me. And it's one of the best things you can do is consider other people who can survive based on your decision.
Mhm. Thank you both for that. Mr. Jones, I want to bring you back into our conversation.
Yes.
Because I heard you say that this tested you when your daughter made that decision. And as a man of faith, a man of God, how has your beliefs about the organ donation changed over time? And again, what would you say to people who are considering donating?
Well, I'd say that my belief in it had never changed. Just like anybody else, the only pure person is Jesus Christ. I fell for that hot second. And I was in my feelings. And I was, upset that this person came into my private space with my daughter to start talking about giving Julia's organs to someone. And so that human being came out, and I just lost it all at that moment until my daughter snapped me back to reality. But the key thing is, as Mr. Ivy said, is that legacy. What my grandson did in his 43 days of life is more than anyone that's lived a full life of 70, 80, 90 years old. And he gave that gift of life back to somebody else. And I'm truly in the opinion of that his life was for that moment. And that's what he was here for. And I had to be that mindset, and also to make sure that our family is a giving family. I have 3 boys. My daughter's the oldest. She's the baby though. And my 8-year-old grandson wants to be a nurse, which is wonderful to see. Black male nurses, more power to you. Thank you so much. I'm hoping I get a recording of this for him because he's currently working. But we've always been servants. I always tell everybody that the biggest way that you can be of yourself is to give of yourself. And my kids are that way. My grandchildren are that way. And Jaleel in his 43 days of life is that way. And when my daughter found out that Jaleel's name lived on still within Live On New York, and his name has been on this wall for 20-something years, we had no clue. And then when she found out that the young lady was giving birth to a baby, I said, God, this 43-day-old young man has left a legacy and a torch so high that us, as we joke around, my kids and I, we always say that when something good happens, we say, well, that's a Jones thing. So Jaleel had a Jones thing going on at that moment. And he's just pushing and pushing, and he continues to push us to do better. And so whenever I have that lack of faith, or whenever my children may have that lack of faith, we think about what Jaleel has done and what we can do to do better. If you're not 100%, you can't give 100%. So we want to make sure that we are able to do all that we can. And I want to leave something real quick, if you don't mind.
Go ahead, sir.
Maya Angelou said, if you're always trying to be normal, you will never know how amazing you can be. I found out that day how amazing my daughter was, even more than I thought she was at that moment. And even more so, how amazing Jaleel is every single day when I think about it. So just to have this chance to speak about him, and again, I'm purposely saying 43 days. Purposely saying 43 because that's not a long time. But the impact that he did in 43 days, who are we to even say that we cannot do that? Because we are not normal. We are meant to be amazing people. So thank you for giving us this platform to hopefully be able to feed into other people of color to say it's okay. Because, church folks, we had my pastor had someone come in to talk about organ donation or even life insurance. I ain't giving up my body parts. You crazy? I'm gonna leave with it. And you have to re-educate people to make them understand the situation. I think your grandfather had a kidney donor, didn't he? Or so-and-so had this. Yeah, they did. So you have to understand where it may have come from, how you can give it back. So I'm sharing this. My kids are sharing this. My family's sharing this. And this is going to be our legacy through Jaleel. So thank you.
No, absolutely. Thank you again for the detail that you've been willing to share with us about your family's experience. I want to give all 3 of you an opportunity to talk just a little bit more to those people in Black communities, communities of color that are really hesitant because of all of the medical mistrust that we know that's in our communities, you know, the lack of representation, and quite frankly, how Brown and Black people are treated in our medical system. You know, with all of that, how would you want to talk to other people about the possibility of becoming donors and being involved?
Well, I think for me, I just kind of share my journey to let them know that, you know, when I was in a hospital, there were, my last stint, I was probably in the hospital 4 weeks.
Mm-hmm.
That year, I had been in and out of the hospital 3 weeks here, 2 weeks here, a week here. But the last stint, I was probably there for about 3 or 4 weeks. And I would walk the wards to kind of keep my physical condition up. And over those last 3 weeks, I would, look in other rooms, and before you know it, there were 4 gentlemen, all Black men, all waiting for hearts on my floor. And 2 of us are still alive, and we're still really, really good friends because they have a serious bond with each other. The other 2 gentlemen both passed in waiting. One was a heart kidney, was waiting for heart lung, and the other one would have been a second transplant. He was kind of like non-conformative after his first transplant. He didn't do what the doctors told him to do. And so I just kind of share my story and tell people that, the impact that they can leave on by donating. If you're a real spiritual person, you have to realize that the spirit will move on without the organs. The organs are just organs. But if they can save somebody else, wow, why not? So yeah, I just kind of share my story, and hopefully it makes an impact on it.
Okay. Mr. Clyde, same question.
I really think there's like a disconnect between the Black community and the industry based on things like the Henrietta Lack story, just of how they would treat people of color in industries like that, and also, even as far as the COVID thing, you got a lot of people asking, they're gonna get the COVID shot or whatever, and I don't know what they put in that, just the mental aspect of maybe it's ignorancy, but I think education would help, and also being active, getting out and letting them know there's nothing wrong with, donation. You are helping the community, because even it's no guarantee that it could be a family member to help you or anything. I have a twin sister and she did not match my bone marrow. Yes, no one in my family did.
Okay.
So, it's just no telling who you can help, and it's always for a reason. Everything happens for a reason in this universe. That's what I put.
Mr. Jones, any last thing you would like to share?
Sure. For us, it's just sharing our story, like Mr. Ivy and Mr. Clack stated. You can never stop sharing. If you're just able to help somebody to make that difference, that be that one person that heard and listened and did it. So continue to share the story. Continue to keep it going. It's a lot of people in our communities don't have access to the internet, so they could not or get on Zoom, or, so we have to meet people where they are, in the communities, in the churches, anywhere that will attract individuals. And we got to go into the community healthcare centers and just put the word out that way. But, don't be afraid to go out and meet where people are, and don't be condescending to them. We can't come across as we know it all, and you're telling somebody ran down their throat. You got to help get them to understand where you're coming from so they can receive it and hear it and use it for the greater cause. So meeting people where they are is important.
Well, again, absolutely. Thank all three of you. I want to now go back to our two administrators, back to Mr. Leday and Mr. Lassant for some follow-up questions. And Mr. Leday, talk to us a little bit about some of the myths regarding donation that you have come across, and how do you talk to people to clarify that type of information or misinformation?
I think one of the biggest myths surrounding organ donation is that the medical team, hospital emergency services won't save your life if they know that you are an organ donor, right? When in fact, it's just the opposite. If your life can't be saved, you can't be an organ donor, right? If your body can't be sustained, you can't be an organ donor. I think that's one of the biggest myths out there. Another one, I think, is the fact that people think that organ donation organizations, hospitals, and people in general profit directly from organ donation. There was a family that we approached not long ago who thought that everybody that works in the organ donation organization, we all drive Bentleys and whatnot. So I think there is a huge misconception about how organ donation is funded, who profits from it, and that there's maybe some sort of direct payment that we get for facilitating organ donation, which of course nothing could be further from the truth, right? The government essentially funds it, the lion's share of organ donation, and we obviously we get nothing for doing organ donation. We just exist to facilitate it and to make sure that if it's an option, that the families know that it's an option. So those are, I think, the two biggest myths that I've come across in my years in organ donation.
Thank you, sir. Mr. Lassant, anything you would like to add, or in that area of things that you have talked with people about? And then after that, talk to us a little bit about how people can work with Live On New York to actually get registered.
Yes, so I guess the only other thing I would add, right, and I hear this from people I know, people in the community, etc., is that there's this thought that Black organs are not going to Black people, and they're just going to go to rich white people, in a sense, and that's far from the truth. There's a list, it's managed, it's run. So, we really just work to try to dispel that myth as well.
Okay, there was a question that popped into the chat. Do the organ transplantation organizations help families with funeral costs?
No, at Live On New York, we do not, just because that would be considered a conflict of interest.
Can you say a little bit more about that? Because I want people to really understand why you would not do that.
Yeah, so it's a gift, right? The donation is a gift. Once you start, and once you start incorporating any type of payment, it can be misleading. And the last thing we would want is someone offering the gift of donation because they want to have a cheaper funeral, right? So we really just try to, we do not in any way make any payments to families to support funerals or any part of the process that would help to facilitate donation. We really try to separate that in every capacity.
Right. So you really are trying to make sure there is no financial inducement or financial enticement. So I just wanted to make sure people really understood that, and that it's not the perception that the organ donation organization is somehow being cheap or doesn't want to do it. It really is some ethical standards here.
Absolutely, absolutely. And to kind of go back to the question regarding registry, here in New York, we have donatelife.ny.gov. That's our state registry. We just continue to work. We really believe in grassroots, supporting our churches, getting deep into the communities, working with our African American groups, NAACP, links organizations, dialysis centers, DMVs and churches, really to try to just get down to the root and talk to the people, right? Like that's really the goal, right? To dispel myths, you really got to talk to the people. Because outside of that, it's really going to be the experience when you have that moment in the hospital, right? And if you wait until then it becomes a bit more difficult, right? You want to capture these conversations outside of the stressful time when someone is losing their love as much as we can.
Well, talk to us a little bit more, specifically about some of the great things that Live On New York is doing to support Black and Brown communities, and how your organization is working with communities to also, again, support what's going on in the community.
Yeah, so for us, for example, I mentioned a links organization, Long Island Links. That particular organization focuses on improving the health and wellness of the Black community, right? Live On New York would have a partnership with such community, right? So that when there are events, we can be there, right? And be there at the forefront to be able to help relay what is organ donation all about. Links is one example. There are a multitude of other organizations that we support, that we want to continue to keep supporting to be able to get the message out.
Yeah. And I also want to point out one thing in which you all have also supported our local nursing association. You all were very generous in your support of the Greater New York City chapter's recent annual scholarship fundraiser. And your organization allowed us to secure some funds that we gave as scholarships to future nursing students. So really want to thank Live On New York for that support directly of our association. It is very much appreciated.
Thank you, and we thank you for the opportunity.
So Mr. Leday, out there in California with Sierra, how do you guys work with the registries, and how do you get people and any specific things that your organization is doing to support the Black and Brown communities?
Yeah, very, very similar to Live On New York. We've got a volunteer core that goes out into the community. We speak at high schools. We actually speak at some of our donor families' memorial ceremonies. We do events at DMVs. We are celebrating Black History Month. So we've had several events, including this one, that center around the African American community. My public outreach and education person could talk more about specific programs and whatnot, but we do, very, like I said, very similar to Live On New York. we have several outreach programs that try to reach to our underserved demographics and to try to get the word out, try to get the truth out about organ donation. We talk about the registry as well. You can donate, you can sign up to be a registered donor if you have an iPhone. It's built into your iPhone. You can do it online through Donate Life California. And like I said, you can go to an event, and we usually have some of our people there that are ready to answer questions, to talk about organ donation, and again, just to kind of dispel the myths and share the truthful information about donation and the process and the good that it can do, obviously. But like I said, just very, very similar to Live On New York. We really try to reach out to the communities and just share the truth about organ donation.
So, and does each of your organizations have brown and Black employees, people that are of the community, that looks like the community that you utilize? Because we know the literature tells us that sometimes you receive these messages better, or more open to them from people who look like you.
Yeah, so we have a diverse team of employees. There's a balance with that, right? Like, you know, it's yes, we have African Americans, and to be able to be present and approach families. We don't want to say that, you know, a Black person should only be approached by another Black person. Absolutely not. You know, but we do have a diverse team of employees. Just being in New York alone, I mean, you know, we try to have a multitude of cultures and diversity within the organization.
And languages.
Absolutely.
Yeah, language. Yeah, that's a good point. It's the same here. We really are trying to represent through employment the communities that we serve. You're absolutely right. The literature, the studies show that people respond to better to people that look like them. So we're aware of that. We make a deliberate attempt to try to look like the communities that we serve. And I think that in going back to the nurses in particular with this event today, whenever I approach a family, and this is going back a little bit, but I want the nurses to know, especially the African American nurses, to know how important they are to the approach of a family. Right? It's always a collab. Nurses are our single biggest, greatest source of information. They've likely had the most contact with the families, have likely bonded with these families. So they are our single biggest resource when it comes to talking with families.
Well, thank you all. There was another question, and we haven't touched on this. So can I get you both to make a few comments about living donations, donations from live donors?
Corinne, you want to go first on that one?
Yeah, I guess. All right. I mean, from the OPO perspective, we manage the deceased donation process. We will support some of our transplant centers with living related donation, but we don't get involved with it from that perspective. You know, I mean, outside of registering people to become an organ donor, that would be it. Yeah, but we manage the deceased donation process alone.
Okay.
Correct. Yeah, and that's nationwide. We really haven't ventured or partnered with any living donor programs at all. Just the deceased donor.
Okay.
Yeah.
All right. Well, Any last comments that you two want to make as administrators, as folks that work within these organizations to our audience today before we bring back everybody?
Yeah, I guess for myself, right, like the recipients that are waiting for a life-saving organ are people from our own community, right? And I implore everyone to really like take the information that you're hearing from this meeting, right? And really talk to your families, talk to your friends, talk to your loved ones, and spread the word. You know, don't wait till it's too late. We don't know when our day is going to be there, right? And it's really, really important to really make sure your family knows your wishes.
Yeah, that's probably the single most important thing, whether you register or not. Even if you do register, talk with your families about it. And I really appreciate this event because, as I just said, nurses are our biggest resource, our biggest conduit to our families. So it's really important, especially being nurses of color, to share with us information about the families, and so we can serve our families the best. Knowledge is king. So like anything else, the more we know, the better we can help and serve our demographic. Also, I just like to say one thing when it comes to communication that I think Kervin said earlier. That's the single biggest factor, I think. I had a family years ago, African-American family, that donated because of an article in Jet magazine. I know maybe not all of you know what Jet magazine is. I won't share my age, but
I was about to say, you're dating yourself a little bit, Torin. You're dating yourself.
Just a little bit, but through Jet magazine, again, communication, this family was very adamant about donating and did everything that they could to ensure that their loved one was able to share the gift of life. So communication is the key. Communication is absolutely it.
You know, as a researcher and academic, that type of what I call, regular writing to laymen, to the masses in either print media or social media is really important. And for people who won't pick up a medical journal, so those types of articles I find to be extremely important, and I would challenge my colleagues to get more into writing some of them. So I want to bring back all of our panelists, and as we approach the half hour past noon here on the East Coast, as we're going to go to, we were scheduled to about 12:30. I want to open it up to our audience that has been so patient and has been listening. So for our audience, do you have any questions for any of our panelists today? You can put them in the chat and I will read them. Or Aaron, can they raise their hand and you unmute them?
Yeah, I can do that for you.
All right. So if anyone has a question, use the raise hand function, and Aaron will unmute you so you can ask your question of our panelists. Kendrick, you had a question that wasn't answered.
Yes, good morning. So we know that people living with HIV are living longer these days, and we just talked about how the African American community is impacted, and we know that the African American community is overrepresented in people living with HIV. So, are there options for people living with HIV to be organ donors, and what does it look like for the future as this population begins to age and live longer?
So
Yes.
I guess.
Sorry.
Go ahead. I'll go really quickly. I know it started on the East Coast, but but yes, there is what's called the HOPE Act. That is kind of a separate waiting list of people who are HIV positive. to donate to others who are HIV positive. And that also holds true for people who have hepatitis. There is a separate waiting list. So, and I'm glad you brought that up, because a lot of times people don't donate because they don't think that their loved one is a candidate for donation, right? Same with hospital staff. We hear from them before we approach a family often that, well, this person doesn't have any good organs, or they have whatever kind of comorbidity or HIV or hepatitis. We wish that they would talk to us first, and this is one of the reasons that we rely so heavily on our nurses, right? If we know what maybe some potential obstacles are, we can address them with our families and with the medical teams as well, because a lot of medical teams don't know what the criteria is, or what patient is actually a candidate for donation.
Do you want to add anything, Mr. Lassant?
Yeah, I guess to Torrin's point, couple of things. So HIV, yes. Currently, there's heart donation via HIV, liver, and kidneys as well. And to Torrin's point, we really try to, our job as an OPO is not to decide whether an organ is suitable for donation. Our job is to make that organ available to the transplant centers, right, for their recipients. Because we have people that they may have minutes to live, hours to live, days to live, right? And every time we make a decision, or a hospital makes a decision, right, to say this organ's not transplantable, that potentially can take away from someone receiving a life-saving organ, right? So we really try to steer away from that as best as we can.
Thank you. Aaron, I see we have Mr. Crockett has his hand raised. Can we ask Mr. Crockett to let him answer this question?
Sorry, I'm doing it right now. You should be able to unmute.
Mr. Crockett, go ahead. Mr. Crockett.
Okay. What would you happen to know what the life expectancy of a transplant patient's kidney would be after the age of 55? I mean, just a round number, because and the reason I'm asking this is because I had been told in the past that there was a window of time in which a recipient should even consider being transplanted because of the potential of not having the maximum use or longevity of the life of the kidney the longer they wait, And so, from your experience, what has been, the time frame in which a kidney would last a recipient over the age of 55?
Well, in my experience, just like Mr. Lassant was saying, we essentially are responsible for letting it known to the transplant centers what organs are available. It's up to the medical team of the recipient to ultimately decide whether or not a patient is a candidate to receive an organ. So I don't know if that answers your question directly, but we don't determine that. That's purely up to the physician of a potential recipient and that recipient, because they do have a say in whether or not they want to receive an organ. But that conversation is usually held between the physician of the recipient and the recipient themselves. So I don't know, maybe one of our recipients can speak to that a little bit better.
Mm-hmm. Mm-hmm. How old were you, Mr. Ivy, when you received your heart, sir? You're on mute, sir.
I was 58 when I got my heart transplant.
And how old are you now, sir?
I'll be 71 in 3 weeks.
Wow.
But you know, people ask me, well, his question I think was about kidneys.
Right, right.
I'm a heart transplant, and when people ask me, well, how long do you know, anticipate you'll live? And I said, well, how long do you anticipate that you'll live? I always tell people I'll probably die from something else, not the heart. So yeah, we don't know.
No, I was just asking that question. I guess I join your ranks because I just received a kidney transplant at the age of 57. And so I'm 59 and I'll be 60 in July. And so I'm just looking forward toward the future. As a matter of fact, this was my second go round. My first opportunity to receive a transplant, the kidney only lasted for 4 months before it went into rejection. And I went on dialysis for about 13 years. And then after 13 years of dialysis, I was fortunate enough to attempt it again. And so far, it's been 2 years in. And so I applaud all of you all who are survivors of you know, this health crisis. And it is a health crisis, but there are options. And you know, I think the biggest thing that you all have said was that there is a need for education. And if our people know what their options are and how to receive the help and also how to give the help is important. So what you're doing, I really do applaud you for what you're doing today and what your work consists of.
All right. There was someone else had their hand raised, Aaron, who had a question.
I'm trying to see the hand.
I want to make sure we don't miss anybody.
I
Anybody?
remember the name, but the hand went down.
Well, does anyone else in our audience have a question for anybody on the panel?
Yes, I do. First, I'd like to say this is Olin Jackson. This was an outstanding program. I really appreciate it. It's dynamic and very informative. I have 2 questions. The first being, with the process of registering to be an organ donor, could you have the stipulation that if in need, it go to somebody in my immediate family first? And my second question is, at what age do you have the right to claim to be an organ donor? And should we have programs like this for our community for, let's say, I don't know, high school level?
Mm-hmm. So, Mr. Leday, you did answer that other question about family. So can you reiterate that? And for clarification, how old do you have to be to personally be able to consent to organ donation?
Yeah, so that's a really good question. So in California, you can register to be a donor as early as 13 years of age, but it doesn't actually take effect until you are 18. So if you register before you're 18 years old, it essentially is an intent, right? It demonstrates an intent. Your parents will still, or whoever your legal next of kin is, still can decide whether or not to donate. So you can register as early as 13, but it doesn't actually take effect until you are 18 years of age. So before that, it's an intent, which is another way of communicating and letting your family know what you would want to do should the worst happen. And most families do continue with the wishes of the decision of their loved one, even though they are under the age of 18. Again, because they know that that's what they would want to do should the worst happen. And the second question was, if you don't mind repeating.
Can a donor direct that their organ be given to a family member?
That is, as far as I understand the California Donor Registry, you can stipulate which organs and tissues you would like to donate. The rest would be done, but you can't get that detailed in a donor registry, but you can in an advance directive.
Yeah, and that's similar with New York. You would have to do that in your advance directive.
Mm-hmm.
The age in New York, I believe, is 16 to register.
Okay, thank you.
Thank you.
Any other questions from the audience as we are at the hour to wrap up our session today? But I really want to make sure we don't have any burning questions for our absolutely wonderful panel today.
We have one with Dr. Stamps here.
Dr. Stamps, would you like to unmute and ask your question?
Great, thank you so much. First of all, this was an amazing event. We have to replicate this across New York State. Amazing. My question is, how do I get the same organizations or similar organizations a listing so that we can replicate this program or a program like this across New York State? Because this is really important. I live upstate in Rochester and would love to do something like this up here, but really across the state. So is there a resource or a way that we could replicate this? Because the stories are amazing. Thank you to the donors, to the recipients, and to the Greater New York Black Nurses for organizing this.
Yeah, you could, if you want to drop your information in the chat, Josie, for your chapter. But Greater New York, they have the representation over on that side, and we'd be happy to connect.
Yeah. And I really want to point out this was a partnership between Greater New York City and Capital City. We value our partnership with our chapter over there in California. Ms. Lassant, do you have a sense of what's available in the rest of New York State?
Okay, you mean in terms of what's available? You mean in terms of trying to replicate this across the state?
Well, yeah, in other organizations similar to yours throughout our state in New York.
Yeah, there's about I believe 4 OPOs that cover the New York State area. And absolutely, we would yeah, if I can get your information, Dr. Stamps, from Aaron, and we would love to continue to do things of this nature. Absolutely.
All right. So it looks like we got some resources coming your way, Dr. Stamps. Any other questions, my colleagues?
Yeah, this is Phil Jones again. I'm just waiting to see when will I see Live on New York and the Black Nurses Association on TikTok, because if we're going to get down to the grassroots, I know that's my dub down time. So
I'm gonna leave that to the younger folks in their social media, Mr. Jones. And we have some folks that can do that. But I'm over there with Mr. Leday. I look. I had a Jet subscription too.
So did I.
I still got my MySpace account. I'm trying to get up to 10 users.
I understand. Well, on that note, I really, really want to thank all of the panelists today. Dr. Kelly, who joined us earlier. Mr. Leday, thank you, sir. Mr. Lassant, thank you. Mr. Clack, thank you. Mr. Jones, thank you. Mr. Ivy, thank you. We are very grateful for you sharing your time with us today. And for you who tuned in, thank you for sharing part of your Saturday with us. I'm actually going to turn this back over to the two organizers, to Mr. King and Mr. Perpignan, to actually end our presentation today. But again, thank you for the opportunity to host such a valuable conversation.
Yes, thank you. Thank you all. Thank you, Dr. Fields, for, I mean, you were channeling some Montel Williams in here. And I would like to thank all our panelists, Live on New York and Sierra Donor Services, and including all of our individuals that shared their personal stories. I shared a link in the chat with a short survey. If you could just complete it and tell us how we did. There's also opportunity to just kind of share some feedback on other topics you would like us to cover. We would like to bring other topics about Black men's health to the forefront and hopefully touch on it virtually with the organizations throughout NBNA. Outside of that, there was also a link, and I will share it again, for an opportunity to register to donate. And it covers pretty much, it's a government agency, but you could go to individual states and register. And Josie, did you have anything to add, sir?
I was just gonna also say thank you for all the participants for joining, and just look forward to more events and partnership between Capital City, Greater New York City, and both of the OPOs. A lot more topics and discussions that need to be had. I think there was a great amount of information that was provided, and I think that our communities need to hear this on a larger screen, a larger level. So
there is one other thing I wanted to say. One, Aaron, I was channeling my inner Oprah. Me and Oprah share the same birthday, January 29th. So that was my inner Oprah, not Montel. That was Oprah. And not Gail, it was Oprah. The other thing I really want to say is never miss an opportunity to make sure that you all know that you are always most welcome to join the National Black Nurses Association in our annual conference. This year, from August 1st through August 6th, we will be hosting our annual conference in the city of Atlanta. And you can find out information right on nbna.org. And we're going to continue conversations like this. There is a Men's Health Institute being planned. And of course, our annual Bowtie breakfast in person, where we will continue these types of valuable conversations. So I couldn't let people go without knowing that they really should plan to be with us in Atlanta.
Perfect. Well, thank you all for attending, and have a great morning.
Bye-bye, everyone.
Thank you again, everybody.